we are going to be looking at universal healthcare and how Kenya is going to achieve universal healthcare. So universal healthcare is about ensuring that all people have access to the needed health services that they need of sufficient quality, and also making sure that as they receive this healthcare, that they are not exposed to financial hardship. And so if you look at this square that we have over here, we are basically making sure that under universal healthcare, the whole population is covered. They are covered for all services, including inpatient, outpatient, and so on. And they are not exposed to financial hardship as a result. So what is the Kenyan journey in terms of universal healthcare? Well, our government has prioritized universal healthcare in what we call the Big Four agenda. And so this is a very important priority for our current government. We also have numerous studies that have been done in order to inform the government about the viability and practicability of implementing universal healthcare in the country. So we had the Health Benefits Expert Panel that did its work in 2018. We've had numerous actuarial studies, and the NHIF actuary actually happens to be here with us, Ezekiel. And so he has done numerous studies on the financial viability of NHIF. We also had pilots in 4 different counties in the country to be able to test and see how the universal healthcare would work. And then in 2019, we had an expert panel called the Health Financing and Reforms Expert Panel that looked at different elements of how to achieve universal healthcare. And I happened to be a part of that panel. And all this has now culminated into the NHIF Amendment Bill 2021. Why the NHIF Amendment Bill? Because from all the studies, it is very clear that NHIF has to be the implementing agency for universal healthcare. So what are the main features of the NHIF Amendment Bill, which is supposed to prepare the country for achieving universal healthcare? The first thing is that there's the introduction of mandatory contributions for every Kenyan resident, with the government contributing for the vulnerable. So right now, it is only mandatory for the formal sector to contribute to NHIF, but under this bill, the proposal is for mandatory contributions for every Kenyan. Now, of course, the question would be, why does NHIF need more money? The thing is, all these studies that I mentioned before have noted that NHIF's financial viability is actually under threat due to the fact that the claims that they pay out are normally higher than the contributions that they receive. Specifically for what we call the super cover, where every Kenyan pays, where the informal sector pays 500 shillings per month, it has been noted that for every 100 bob, every 100 shillings that a member contributes, 250 shillings is paid out in claims for that particular member. And so that is the first thing that is important to note that this bill is trying to address. The financial viability of NHIF is not very safe. And so the fund needs more funds for it to be able to achieve universal healthcare. The second thing is the introduction of mandatory employee contributions as well as employer contributions. So currently it's only employees who contribute, but now there's going to be the introduction of employer contributions. Thirdly, there's a new relationship between private insurance, a new relationship with private insurance in the payment of claims, and we're going to go much deeper into that. Fourthly, there's an improvement in the governance of NHIF. Right now, the board salaries will be paid in line with the Salaries Remuneration Commission. The CEO qualifications have been improved, and assets of the fund are not liable to attachment. Lastly, there's a lot of improvement in the transparency of NHIF. For example, the list of empaneled providers will now need to be gazetted. And so as I sit where I am as an actuary, I really want to just commend the government for all the work that has gone into this, and because universal healthcare is important, and I can say that we are leading the way in Africa. And I mean, the spirit behind the bill is a really good one, and I believe most of us are in agreement that what the bill is trying to address is crucial for every Kenyan. So what this webinar will focus on is mostly on the practicability of implementing universal healthcare.